Hello, I'm Elliot Tapper, co-editor-in-chief of Hepatology Communications. It's a new month, and that means a new issue of our journal, and I'm excited to bring to you a summary of the best in clinical research, leading off with a report from rising star Dr. Catherine Cooper, who identifies that among reproductive age women, those with low anti-Mullerian hormone are at highest risk of developing MASLD in midlife, casting additional light on the complex interplay of our various endocrinologic systems and this very important chronic liver disease. Beyond that, we're excited to share with you a report from the clinical trials of Resmetirom led by Dr. Zobair Younossi, showing that those people who were treated with Resmetirom had significant, meaningful improvements in their health-related quality of life measured across multiple indices. Not only are we now able to improve liver histology, we're able to help people with early MASH as well as those with MASH cirrhosis live better. Beyond that, I'd like to draw your attention to an interesting report from Dr. Amit Singhal, who is exploring the validation of longitudinal biomarker-based screening algorithms for HCC. A new day has dawned for cancer screening. We're increasingly using blood-based tests in hopes that this increases access to cancer screening, but what's the right cutoff? And what do longitudinal changes mean? And within that report, you will learn all about the sensitivity and various trade-offs in different cutoffs. And this is absolutely foundational work to the implementation of this new and super powerful approach to improving the care of patients at risk for liver cancer. Dr. Vlad Ratsu published in our paper a very interesting report about the changes in liver fibrosis for people undergoing bariatric surgery. There's a couple of key messages here. Bariatric surgery was helpful in reducing fibrosis burden, and they used a super innovative, unique single fiber digital pathology quantification method that was empowered through artificial intelligence to rapidly quantify the amount of fibrosis in these samples. The future is near. And finally, I'll call your attention to an interesting report from Proto Papadakis and colleagues in a large multi-center transplant group. They conducted a systematic review of post-liver transplantation treatment and outcomes for late T-cell mediated, chronic ductopenic, and antibody-mediated rejection. These events happen, and when they do, we often turn to very limited reports. And so we're grateful to share with you a systematic review that puts it all together, cobbling together what clinicians have done for patients, what outcomes they've observed, and what the gaps in the data, remain. So I hope you read, I hope you enjoy, and I wish you all the best. Until next time, have a great day.
Hi everyone, I'm Carmen Wong, the co-editor-in-chief of Hepatology Communications. This month, I'd like to feature two interesting papers that highlight important mechanisms contributing to liver diseases. The cGAS pathway is a cytosolic DNA sensing pathway primarily designed to detect viral DNA and trigger an immune response. However, increasing evidence indicates that cGAS has functions beyond viral DNA detection. A very interesting study led by Sabo demonstrated that cGAS deficiency or inhibition can worsen liver damage in alcohol-associated liver disease. This occurs through the enhancement of the unfolded protein response, increasing production of pro-inflammatory cytokines, and the recruitment of neutrophils. Another interesting study led by Liu and Zhu showed that SBP1 positive macrophage and integrin A5 positive fibroblasts interact in HCC, which promotes MMP2 production in calves, leading to HCC metastasis. This study is supported by single cell, spatial analysis, and detailed mechanistic studies with in vitro culturing, co culturing, and in vivo validation. Check out these papers. See you.